local news station.
Thanks for joining us here on KRON on this Easter Sunday. I'm Noelle Bello. Many churches were filled with parishioners this weekend for the first time in over a year as people celebrated Easter. But over at Beebe Memorial Cathedral in Oakland, the pews were filled with people getting their COVID-19 vaccine over the last couple of days. Joining me now is Alameda Health System Interim CEO James Jackson to talk about this pop-up site that happened over on Friday and Saturday. I know you guys received about 1,000 doses. How did it go?
It went fantastic, Noelle. Thank you very much. We had a really great collaboration with Beebe Memorial Cathedral and the Reverend Dr. Charlie Hames, as well as with the state, with the governor's office. And we also work closely with the Healthcare Services Agency here in Alameda County. And so with all of these groups coming together, we were able to deliver actually over 1,150 doses on Friday and Saturday.
Wow, so it really was a good turnout, as we can see on this video. When you saw that the turnout was just as you were hoping, how did that feel to see the community coming out to make sure they were vaccinated?
You know, I cannot tell you how good it felt. Our team has been working, like all healthcare organizations, extraordinarily hard for the past year, and having the opportunity to have staff on site delivering vaccines, putting needles in arms, and really knowing that they were in a tangible way helping people get through this. The staff were extraordinarily moved, and it was just such a great experience, I think, for everybody.
Talk to me a little bit about how you all were able to acquire these doses, because a lot of people talk about, you know, supply not necessarily being what we want it to be, but this is one of many of these types of pop-up vaccination sites that we've kind of seen over the last few months. So talk to me about how you all were able to acquire those.
Yes. We were contacted last week by the governor's office. A representative of the governor's office contacted Reverend Hames, who contacted Alameda Health System. And we were advised that the governor's office was working to put together 5 clinics at Black and Latinx churches across the state to administer a total of over 5,000 doses, 1,000 doses per church. And so we had a little over a week to try to put this together. And so, you know, it was an amazing effort on everybody's part to put all the pieces together to deliver the doses, and it worked out amazingly.
Wow, just over a week, and you were able to get about 1,100 people out there.
That's right, yes.
We talk a lot about folks being a little nervous about getting the vaccine, not necessarily wanting to receive it. And this is one of those communities that folks talk about, Latinx and African-American communities that are a little more reserved when it comes to jumping up and getting a shot. Why was it so important for you to jump at the opportunity to get these doses from the governor's office?
We really are committed to our mission, which is caring, healing, teaching, and serving all. It is a poorly kept secret that communities like the Latinx community and the African-American community have hesitations and concerns. And so we are taking every opportunity we can to outreach to the communities to provide facts. And so on our webpage, we have a lot of dispelling mythology information available for folks. I would encourage people to go to the AHS website if they want to learn more about the vaccine and some of the concerns they might have. And so when the opportunity presented to partner with the Beebe Memorial Cathedral, we really felt like it was imperative that we take the opportunity and rally our forces to get out there and deliver these shots. And the results are fantastic. We really feel like we made a huge impact over the past 2 days.
Were you out there yesterday and Friday?
On yesterday and Friday and Saturday, I was present. I was a bit of a cheerleader. I'm not a clinician, and so that's the last thing folks want is me delivering shots. But to the extent that I could support the team, I was more than happy to do so.
And the reactions from people, conversations that you had with folks, what were they saying?
They were just so grateful. I took the opportunity to speak to a lot of the folks who showed up and just ask them, you know, how they hear about it and how are they feeling. And to thank them for trusting us to provide this care opportunity for them. And it was universally just a wonderful response. People were grateful that Beebe and Alameda Health System had partnered with the governor's office to do this. And my hope is that we will be able to do more of this. And so I'm looking forward to other opportunities to collaborate and to be in the community on behalf of the Alameda Health System.
that was going to be my next question. Do you have any more pop-ups scheduled in the coming weeks?
They're not scheduled, but I've been talking with other community partners about the prospect of doing more like this. I think that we've got to try to create synergies across this community to really, in a proactive way, make sure that we're getting out there and delivering the care and the vaccines to the extent possible. And so I'm very open on behalf of the Alameda Health System to these sorts of collaborations.
As far as how many vaccinations, I'm not sure if you have the number. This might not necessarily be something that you have on hand right now, but I'm curious, as far as the Alameda Health System goes overall, how many vaccinations have you all been able to administer so far?
Oh, what a wonderful question. I don't have that exact number, but we've been having clinics in our facilities for some weeks now. And so I know we've delivered a lot of doses, and I would be happy to get back to you with more specific information. But we have been primarily delivering the 2 doses, and we recently acquired the Johnson & Johnson, which is the 1 dose. And so we're really happy now because we're able to deliver the 1 dose for people who are in our clinics and in our emergency room who we may not be able to see a second time to deliver the 2nd dose. So it was terribly important for us to have access to the J&J so that it's a one and done opportunity, and we will continue to deliver as much as we can receive.
And that was the J&J that folks received over Friday and Saturday?
That's correct.
Nice. So they won't have to worry about that 2nd follow-up dose. That's really great. Anything else you want to share about these pop-up vaccinations and why they're so important?
I would just share that, the best vaccine is the one that you can get access to immediately. I know there's questions about whether people should have the Pfizer, the Moderna, the Johnson & Johnson. And I think that Dr. Fauci has been very clear. They're all highly efficient, and that it's important that people take the opportunity. I would urge people not to wait. I was an early receiver of the vaccine. And frankly, it wasn't because I necessarily am front line, but because I wanted to make sure that people saw that I trusted this enough to get my vaccine early on. And I urge people to take advantage of the opportunity.
I know they say not to take the selfie of your vaccination card or make sure you cover up the date or, your birth date and that sort of thing. But I do think it is important for people to see others like them receiving the vaccine, yes, knowing that they're okay afterwards, and just kind of continuing on that conversation that it is a safe thing and the safest thing for us to do.
That's exactly right. Yes, indeed. Yes. And so thank you for this opportunity. I appreciate you reaching out. We realize that we are a haven for the most vulnerable people in our community. So we're constantly trying to find ways to advocate for equitable, compassionate, and culturally sensitive care, regardless of social and financial barriers. That's the work of the Alameda Health System. So thank you for allowing me to have this time.
Of course. Thank you for doing your part to help us get out of this pandemic. Really appreciate it. Thank you so much.
Absolutely. Thank you. Have a great day.
You too.